What can you eat for dinner with type 2 diabetes? I'm going to show you. Let's go. Hey everybody, Mark Green here, the Diabetes Diet Guy, bringing all things diabetes and healthy living. Now in this video, and I'm going to make it a quick one, I'm going to show you what you should be eating at your main meal to help manage your glucose levels. Now, we're not going to talk about individual foods in this video because you don't need to be looking at individual foods. It's more about the distribution of the diet. So, literally, if this is your dinner plate of an evening, this is what most people's dinner plate looks like. You have primarily carbohydrates. These are the ones that affect your glucose levels. We have protein, usually meat. And then we have a small amount of veg, maybe no veg at all. So the dominant nutrient on this plate is the one that affects glucose levels. And I always say this, it doesn't mean these are unhealthy, but it does mean that your body can't use these properly, and therefore it could cause your glucose levels to go high. So rather than thinking about individual nutrients, like carbohydrates, like protein, like veg, what are the best individual foods, we just need to keep simple principles, guys. And it doesn't get much more simple than this. You change that plate, and you do this with it. So now we're going to make the starchy carbohydrates a small portion. You don't need a huge amount of these if you're not being particularly active. So really, if we manage this, one, we're going to be managing the glucose levels. We're going to be reducing that carbohydrate load, that glucose load going into your body. So we've already reduced the potential for spikes. Then, this is the part that's open for debate, although the evidence is pretty clear when we look at the medical literature. Ideally, we want the vast majority of our diet coming from vegetables because they are high in fiber, high in micronutrients, which means vitamins and minerals. And when we look at most studies, good studies, big studies, people that eat high levels of these do better in life with their health. And then we want to dedicate a small proportion to the protein. Okay, meat, fish, eggs, cheese, those kind of foods, or meat replacements if you're vegetarian, soya, tofu, corn, just as good. Ideally choosing leaner sources of protein. Now this may change depending on what you're doing. Obviously if you're more active, you might need a few more carbs. If you're resistance training, you might need a bit more protein. But generally, day to day, what we want to do is base the meal around the vegetables because again, time and time again, big studies, the evidence shows this is the best stuff to be eating. Okay. It's also low calorie, helps to manage your weight, which is the driver for diabetes for most people. And also low carb. They're not going to really spike your glucose levels. I see people scrutinizing vegetables, how many carbs are in them, and they cut out certain veg. And it's just the wrong approach altogether because relatively to the big hitters like starchy carbohydrates and actual sugary foods, vegetables don't really have that much carbohydrate in them at all. You can pretty much go to town. If you're getting spikes after eating vegetables, and I mean spikes in the realms of your glucose levels are rising above 3 at the minimum, but we're talking sort of 5, 6, 7, 8. If you're getting that from vegetables, it means that we've got a bigger problem here, and actually we need to look at the diet overall. You might see a slight excursion, maybe 1 or 2, it's going to go up a little bit. That's normal. That's not a big issue. Okay, but if you really don't like veg or you've got some intolerances like IBS, then we can also open out this protein category and make the diet more reliant on the protein foods because they also don't spike glucose levels, but ideally choosing those lower fat foods because, as I say, weight gain for most people is what's driving the diabetes in the first place. So if you're still putting too many calories in, then you're going to gain weight or not lose weight. So we're really trying to create a condition where we're encouraging you to lose weight, and that treats the underlying problem of the disease in the first place. And as a result, you start to recapture that metabolic health. Okay, so real simple. That's all you got to do. You just got to change the distribution from today and your glucose levels will get better. Think about it, and I'll see you later. Thanks for watching, guys. If you need an extra helping hand with things like this or working with you on a more personal one-to-one level, then do get in touch. Visit diabetesdietguy.com. We have consultancy services and we'll get you where you need to be through support, education, and ultimately being there for you. Thanks a lot. We'll see you later.